I'm right here.
Hi, everybody.
Oh, how are you?
Okay, wait, it's taking 1 second. Hi, here we are. Hi, everybody. Hi, guys. It's Wednesday. Cultivate Fertility. We're talking about cool fertility stuff.
Well, I think some things everybody doesn't just know, some things we had to look into so we can share them with you.
I'm Dr. Hillary Fredrickson. I'm out in California, and this is Dr. Kara Burkhart. She's coming from cold Connecticut today, and it's late there, so she wins an award. Today was her first real cold day, right?
It was cold. Yeah, it was hat, gloves, gonna pull out the ski pants to go on dog walks.
Oh, shame.
Yeah.
Okay, I am just gonna I'm gonna grab my phone so that if anybody has questions in the chat, if you guys are watching us live right now, Wednesday at 5 p.m. Pacific, if you're live and you have questions, you can just write them in the Facebook right here on the Facebook Live, and we'll get to them. There's sometimes a little delay since we're kind of on a Zoom, blah, blah, blah. That's how it goes. So feel free to write any questions. And Dr. Kara, tell me about vitamin D and why it matters right now.
Right now. Okay. So right now in the world, a lot of people are talking about vitamin D because we're going into winter and you need it for your immune system. So I think that's the number one thing that people think about with vitamin D is, we don't get enough sun in the winter. Sunblock blocks our skin from being able to synthesize it. And we know that we should be taking it. Sometimes it's in our multivitamins, sometimes not. But what we want to talk about is why, if you're trying to get pregnant, it's incredibly important. And unfortunately, we've all learned the word pandemic recently. Well, in pregnancy, actually, it's an epidemic vitamin D deficiency in women. So it literally is an epidemic that women are so low in vitamin D going into pregnancy that we all need to be really careful in thinking about what we're supplementing them. And so I'm talking about supplements really because vitamin D, Dr. Hillary and I went through all the foods we could possibly come up with for vitamin D. And we made mushrooms one of our fertility superfoods for a few reasons, but it was really one of the only foods we could get vitamin D from. I know it's fortified in milk and, if you eat liver, I guess, I don't know that I want people really eating liver, is that clean? I'm not really sure. But you don't get it enough from your diet is the whole deal.
Eggs had a little bit, but it's just, again, not significant
enough to
move the needle.
And we really think that people have suboptimal levels going into pregnancy quite a lot. So we do think about that, but we're backing up to, before you're pregnant, what are we thinking about? Vitamin D is a fat, so it's fat soluble, which is why it's sort of in eggs and they put it in milk, because it won't like fall out of the milk. It's in the fats in the milk. And we know a lot about fat soluble vitamins that we have 4 in the body. It's vitamin A, vitamin K, vitamin D, and vitamin E. And they store in the body typically. We'll get to vitamin K later, but vitamin D all summer long, if you're outside, and we're hoping you get outside and get some air, your body's making it from cholesterol and you're storing it up. So right now should be like your highest level.
Your body's making it, but your body's absorbing it from the sunlight. Mm-hmm. When in the spring and summer months, when the sun is high and we are at the right kind of latitude and catch it. Sorry, I just wanted to say.
Yeah.
And so go ahead. So we have this vitamin D.
So do you remember back when we were in school? So we were in school a really long time ago.
When we're so old that when we were in
medical school, it was a while ago.
We're so old that when we were in medical school, we learned that it was, we were taught that it was this like
totally
very narrow window of supplementing, and that it could be very toxic at high levels.
Right, because it's fat soluble, so it stores in the body. So, we better be careful giving it to people. And you couldn't walk in like CVS or Walgreens or wherever you go and see like vitamin D. Like it wasn't really for sale. My grandmother had terrible osteoporosis. And I remember, this is scary. This is going to gross you out. She had this spray up her nose of like some salmon oil for vitamin D that was a prescription. And that was how she got vitamin D, because you couldn't buy it anywhere. It was super toxic and everyone was scared of it and the side effects. And then when we were in medical school, they started testing it in people. And I always think of this and always share it with people, because it was women with musculoskeletal like aches and pains, like muscle aches and pains. And we don't think of vitamin D. If your like muscles are tight up here, or your low back, or you work out and you have muscle fatigue, vitamin D might be the thing that you're low in. So anyway, that was the first research, and we started giving it to people, and then we started testing it. And this, I'm going to say, was maybe like 15, 20 years ago.
And we went to medical school in Seattle.
Right.
And Seattle is a place that has notoriously low levels of vitamin D, high rates of high suicide rate compared to the national average, right? High rates of some
coffee intake, because we're all totally depressed living in Seattle. We just have to drink coffee all the time. Right?
You need a lot of stimulants, and then high rates of MS, right? And some autoimmune diseases that are kind of specific that work in northern latitudes. So scientists started to kind of put it together like, oh, maybe there's this sunlight connection. If people in these northern latitudes kind of have these more prone to depression, more prone to autoimmunity, what's happening here? Right. And so that was one of the dings. So vitamin D, just to back up, it's really crucial for calcium absorption. So that's the reason why Kara's grandmother, who had osteoporosis, which means a kind of weakening of the bones, essentially, where there's not necessarily enough of a good strong matrix. And so that's what they used to only think was the only role of vitamin D, that it helps it was necessary for calcium absorption. And what we now know is that it actually works like a hormone. And Kara was saying this today, because we were writing a blog post about it today. And she was saying that if it was discovered right now, it would no longer have the name vitamin. It would be like called hormone D.
Hormone, whatever. It looks like a hormone. It has that cholesterol backbone, which is why we're always harping on people to eat their good quality fats and stuff. And so if we found it today, we would think it's a hormone, because guess what? It works all over the body. And for fertility, there are receptors. So different tissues in your body like have these things that sort of grab onto vitamin D. And guess what? It's in the lining of your uterus, in your ovaries, and all throughout sort of reproductive tract. So ovary health, super important. Eggs, all kinds of research there, PCOS research, all that with vitamin D. And then that lining of the uterus is really important, because that's where the embryo kind of adheres, and then you get a placenta and you can feed the baby. And that's where a lot of errors happen that are connected with miscarriages. So I always think about vitamin D there. I'm like, you need it to set up a good placenta, vitamin D. And maybe you're just not setting up a good placenta. And so let's look at the vitamin D level. And Dr. Hillary and I were talking today about this. I'm really coming up against being able to order vitamin D easily for people. I think you can go to an independent lab, but insurance companies are kind of pushing back against that lab order for me more recently in the last few years. But I used to be able to order it all the time. Everyone was low. So I'm not so concerned about.
I test it in almost every single patient and have for the last really 14 years. And maybe 12 years. I can't remember but starting in pediatrics, like going into flu season, we were always testing kids' vitamin D levels. And my God, I've only had one patient, actually two patients, that were in a range that was high, that I thought, oh God, maybe this should come down. One was a long distance runner from Australia. So she was running like 20 miles ago outside in the Australian sort of outback. So that was like kind of extreme sun's exposure. And the other one was taking extremely high doses for a really, really long time. And her doctor put her on these really extreme high doses because she was low. Not me, but a different doctor. And then no one told her kind of the end point. And so when I retested her, she had a very high level, not dangerous, but high enough that I was like, wow, these are the only two patients I've seen that are in the 80s.
Mhm.
And many doctors say that in order to prevent cancer, because vitamin D works in the immune system enough that it's thought about as cancer prevention, part of a protocol, or
It's linked to certain cancers, right?
that
Like,
low vitamin D is a risk factor for certain cancers. So we want it high. They are talking about having a protective level of somewhere like between 60 and 80. The majority of patients I test who are not supplementing are around 20 or 30.
mhm.
And then many people who do supplement can kind of only get it around 40.
Yeah.
And for your fertility, why it matters so much is it for women who have recurrent miscarriages, many of them a low vitamin D can be a risk factor. Oh my God, that's just such an easy thing that we can change.
Right. And you want to take it anyway for all these other reasons, muscle aches and pains, your immune response. It's really important. So it's one of those things that people say, if you ask any doctor, like, what supplement should I be taking? Vitamin D has to be like right up
Top
there.
4.
It has to be in the top 4. Yeah.
Well, we had this foundational 4 that we were coming up with from Cultivate Fertility, right? That just kind of like most humans, or at least Americans, are deficient. And that's vitamin D, a probiotic, a great fish oil, and
Prenatal.
the prenatal that has multi. So that's kind of was our fertility, our Fab 4 that we talked about, fertility Fab 4.
Yeah, we usually check on people being on those things. Mhm.
And especially, like we said, for vegans, anybody that's had a recurrent miscarriage, like Kara said, anybody that's got cramping, they've now said that such growing pains, like kids used to say, I mean, practicing pediatrics all the time, people are like, they have growing pains, growing pains.
Mhm.
Growing pains has pretty much been discovered as just a vitamin D deficiency.
Mhm.
And that actually, it's like this action where the bones, the calcium's being extracted from the bones, or it might have sort of a painful thing, or it's not actually, it's just that growing pain is typically vitamin D deficiency. And if you supplement good enough doses of vitamin D, you get there. We know it helps egg health. We know it helps sustain pregnancies. We know it helps mental health during pregnancy, postpartum depression. So like these are all things that are super important. And we're not even talking about the immune thing. I mean, number 1, flu prevention, really. It's like having a good, solid vitamin D good level. So it's just like public service announcement. Now's the time. It's November. We were just looking at a map that showed really the majority of the United States in the winter months and don't get enough vitamin D, even if you're outside, even if it feels sunny. I think maybe if you're in like southern Texas or maybe southern New Mexico, you're fine, or Florida, but like anything, I think it was like north of Tennessee for sure, northern central California up, everybody who's taking it everybody needs to supplement it essentially. And so
The government says this too. Like, this is the government recommendation. If you look at sort of what health advice that has been established by looking at the research, it says 2,000 international units a day for every adult in the United States is what they recommend. So I just think, people should know that it's an important thing. When you're pregnant, you need more, you can get to that, but general advice, look at getting some vitamin D. It's very few people that should not be taking vitamin D. And so
if you've had a recurrent miscarriage, if you have a low ovarian reserve, if you have some fertility issues, it may be worth asking your doctor to test your level and just get a sense. Because if you're one of the ones that, and for me, like Kara and I did these really interesting genetic tests at a fertility conference where we were looking at a whole bunch of hormonal
all our hormones, right? That was
genes.
so interesting.
And it was really interesting. And my vitamin D, no matter what I do, is like in the 30s, and I take a lot of it. And both of my genes, I had one that was homozygous negative for absorption, and then one that was heterozygous for transport, meaning that like genetically, I was just like not set up to have great vitamin D. So I have to supplement at a higher level. And it was interesting because I always wondered, why can't I mean, I'm kind of a sun person. You can tell from the lines that I haven't been so sun protective. I grew up in Vegas, like I live in California. Why am I have this weird low level? And it's because it's genetic. So some of us just have our genes work against us with vitamin D, and it's worth testing or asking your doctor to include it in any kind of lab work if you have an infertility diagnosis, I think. And the other thing is, let's talk about K2, vitamin K2, and the role that plays, because that can be confusing for people.
Right. Vitamin K is, if I'm going to take vitamin D, I want it with vitamin K. So vitamin K is one of those fat soluble vitamins like we discussed earlier. So A, K, D, and E. But vitamin K doesn't store in the body. So vitamin K is one that very few people get enough from their diet. If you sort of look at Americans and what we eat, and here's why. Vitamin K, the best source is really dark green leafy vegetables. And we're always talking about this. We're always saying like 2 to 4 cups a day, dark green leafies. You just have to get it in. It's part of our fertility diet. We are always talking to people about that because there's so much good nutrition in there. But even that might not be enough. So a good prenatal should have vitamin K in it. And it could be with your vitamin D too. So vitamin K actually helps the vitamin D get to where you want it. So we want to get it in our uterus to our lining. We want to get it to our ovaries. Maybe vitamin K is going to help us. It looks like the big risk with taking vitamin D that we're worried about, taking high amounts, having too high levels, is heart disease and stroke and heart attack, that kind of stuff. Because calcium, remember, vitamin D helps you absorb your calcium. And calcium, if it's too high in your blood vessels, can contribute to plaque, like the hardening of your blood vessels, and give you stroke or heart attack later on. So people get worried about walking around with too high of a vitamin D level because maybe it's pulling so much calcium in, and it's laying down a plaque. Vitamin K takes the calcium out of the bloodstream and puts it where we want it, like in our bones and into our tissues where it's being utilized. And vitamin K is really interesting. So people always ask, is vitamin K in pregnancy safe? And it is. I mean, it shouldn't be taken at massive levels like anything else, but it's definitely in prenatal vitamins. And if you see it in your vitamin D, just look at it and make sure that, it's a reasonable level. But they did a research study, which is really neat, that I was looking at with vitamin K, where with some women in pregnancy, they get osteoporosis in pregnancy. Their bones get really, really weak because there's a big usage of calcium, especially toward the end of pregnancy for development and against the woman. So you're kind of pulling calcium out of your bones potentially. Anyway, so there was a study. It's only 4 people. It's like 4 women who were pregnant. And what they did was they gave the women vitamin K, and it fixed the bone loss problem. So that's really neat to know. It wasn't that they gave them more calcium. That wasn't it. It was that they needed vitamin K to get the calcium into their bones. So that's really a kind of a cool thing to think about. And vitamin K is used for a bunch of other things, but it is definitely worth noting that you do not store that. So you have to constantly be getting your dark green leafies and in some supplements. It's another one of those things. And that's the up and coming one. We're going to be hearing more about vitamin K for sure. Like,
For sure.
we've in our own careers, and we're not that old. Come on. We've seen this whole shift with vitamin D. Now we're going to see it with vitamin K, that everybody's like, how much is in my multi? How much should I be having, et cetera?
I want to say one thing also about PCOS. So anybody who's been watching us for a while knows that I have it. Women who have high levels of testosterone or androgens, androgenic hormones, and have a low vitamin D potentiates that and makes it a bit worse. Makes it so that the progesterone level is lower, makes it so that the androgens go a little higher. So I didn't know that at all. And I was
don't think anyone knew that. I don't think anyone knew that at that point.
Well, anyway, I learned that studying about it. And so that's a really important one for PCOS. So the thing about vitamin D is that in most prenatals, it's about 400 IUs, which kind of was the old recommendation to kind of cover the bases. That's the old recommendation. And so the new recommendation is really around 2,000 a day. So if you have it in your prenatal and you think, oh, I'm getting enough, make sure you're checking it. And especially if you live in a northern latitude, if you live above the line, like above Tennessee, and you're above that line and it's the winter time, my goodness, make sure you're taking it, especially if you've been struggling with infertility. If you're doing IVF, if you're doing extra special fertility work and you have a low vitamin D level, it's really going to work against you. So it's just something to really kind of be aware of. So
right.
that's
In pregnancy, it can go up to 4,600 IUs is what is recommended to take. So that 600 or 400 that's in your prenatal might not be enough. So you might have to really think about that. And it's like now you have to do math. It's like a whole extra thing of what to do. But get your vitamin D in some way, and you probably can't get it from food. So be realistic about that.
Yeah, and if in the summer, spring and summer months, if that's when you're watching this, if you're outside for what is it, 15 minutes, 15 to 20 minutes, and you without sunscreen and you're getting some sort of good coverage, that's usually enough once we're in the summer months to help keep your levels strong. So, and obviously there's a lot of reasons why cold and flu season is in the winter, but a low vitamin D level is one of them. Where it just makes people more susceptible. So during this kind of intense winter when the pandemic's at play and flu's at play or whatever, just take your vitamin D. So that's that. I'm so glad we talked about it this Wednesday. It wasn't like, it's not the most rock your socks off exciting topic, but
Yeah.
it is one of those basic things that we see missed a lot. And we just want to make sure that that's not happening to you. So reach out to your doctor if you want to get your level tested or ask them about it, or check your prenatal and make sure you're getting enough of that. And
Go vitamin D.
go vitamin D. Happy Wednesday, everybody. We'll be in touch. And on Fridays, we're always over on Instagram, Fridays at 1 p.m. Eastern. No, sorry. I do it every time. 1 p.m. Pacific, 4 p.m. Eastern. We're over on Instagram Live. And often on Fridays, we kind of give deals, or we just kind of make it fun. And it's a little less sciencey and a little bit more fun, and talking about patients and studies and answering questions live. So join us there. And the other thing I want to say is we often send emails. So if you're on our email list and you don't see our emails, we've been having this just kind of discussion that make sure that you just kind of, if you want to get our content, then make sure that you save us as a contact or whatever you have to do so that we don't end up in your promotion folder. So that's that. Signing off from Cultivate Fertility. Goodbye, everybody. Take good care.
Bye.